Good day, I am Jasmine Sudanya from BSN212G, and in this video, I will be performing the basic life support for adults, children, infant, and newborn return demonstration. So I am going to perform the adult cardiopulmonary resuscitation and AED skills first. So upon arriving at the scene, first thing to do is to scan the environment if there are any hazard present that could potentially harm us. So after ensuring that the scene is safe, shout for help. Help! Everyone help! We got an unconscious woman here. So after that, check the level of consciousness and responsiveness by tapping the shoulder and asking if she is okay. Ma'am! Ma'am, are you okay? Ma'am, can you hear me? Ma'am! And then after that, we have to check the pulse and the breathing. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So now that I see that the patient has no movement or not responsive, I am going to activate the emergency response system by telling a bystander to call 911. Sir, can you please call 911? We have an unconscious woman here. So after that, I am going to do the compressions. So place hand on lower half of the sternum and interlock the fingers. So now I am going to start doing the 30 chest compressions in 15 to 18 seconds. So compress at least 2 inches and make sure to have a complete recoil after each compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So then immediately give 2 breaths with a barrier device. So give each breath over 1 second and make sure that there are visible chest rise with each breath. And after that, resume doing the 30 chest compressions and 2 breaths until an emergency responder arrives to take over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Now for the AED or the automated external defibrillator, let's say I am the second responder, so the AED will help those experiencing cardiac arrest. So it will provide an electric shock to help the heart reestablish an effective rhythm. So first is to turn on the AED. So while doing that, quickly assess the patient's chest. So if the patient has hairy chest, we may have to quickly trim the area in which the pads of the AED will be placed, because it may act as a barrier that and then the AED may not be able to deliver the appropriate shock to the patient. So then we have to attach the pad correctly and place one just below the clavicle and on the right of the patient, and another beneath the armpit just below the nipple line. So now the AED will analyze and it will tell us to stop doing the CPR or touching the patient. Now clear to safely deliver the shock. Everyone clear. Delivering shock in 3, 2, 1. Shock delivered. So after that, the AED will tell us to resume 30 chest compressions and two rescue breath or how many cycles. And after that, it will reanalyze again and it will deliver shock. So we will continue doing that until the AED will tell us to stop, or until the patient have revived. And also remember to switch roles every 2 minutes or after every 5 cycles, since it is exhausting to do the chest compressions alone. And also remember to practice good team dynamics, because it is the key in leading efficiency and patient safety. So I will now proceed to the pediatric resuscitation. So this involves a child or an infant who needs immediate resuscitation. So to begin, open the airway and check for breathing using the look, listen, and feel method. So look at the chest. If the rise and fall is present, listen for breathing and feel for breath on your cheeks for 10 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So if not breathing, then give 2 rescue breaths using the barrier device to prevent unsafe contamination of body fluids such as blood-borne pathogens and saliva. So after that, check the victim for signs of breathing and circulation.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So if there are still no signs of circulation, then proceed to cardiopulmonary resuscitation. So if my patient is an infant, I have to use 2 fingers and place on the lower half of the breastbone below the nipples. So an infant's body is much smaller, so you only need to use 2 fingers for compressions instead of your hands. So then compress the chest at a rate of at least 100 compressions per minute. So that is 30 compressions in 15 to 18 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So then immediately give the infant 2 rescue breaths. So we have to give 5 cycles of chest compressions and 2 rescue breaths after each cycle until the responder arrives. So now if a patient is a child, I have to put one hand in correct position for chest compression, then still give 30 compressions and immediately give 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So same with the infant, continue 5 cycles of compressions and 2 rescue breaths each cycle until the responder arrives. So after 1 minute of CPR, pause and check the patient for signs of circulation.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So now if the patient already has circulation, then put the patient in a recovery position. So with the patient in lateral position, bend the patient's elbow of both hands and place the back of upper hands under the face. And also bend the knee to 90 degrees to prevent from rolling. So now document the time the procedure started and then the time of recovery. So I am now going to proceed to the infant cardiopulmonary resuscitation. So the first thing that we will do is to assess and check for response and for no breathing or only grasping at least 5 seconds but no more than 10 seconds. So I have to tap the baby and shout to attract attention. Baby, baby, are you okay? Baby, baby, are you okay? Someone, please help me. The baby is unresponsive. So now let's check the breathing simultaneously by opening the airway and lifting the chin. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So if the baby is still unresponsive and no normal breathing, send someone to activate emergency response system. Sir, the baby is unresponsive. Please call 911 immediately. So now we will check the pulse at no more than 10 seconds to determine if there is a pulse present. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So now pulse assessed. So after that, I will be giving the patient the high quality CPR. So in doing this, we have to give the adequate rate and depth by delivering each set of 30 chest compressions in 18 seconds or less with a depth of approximately 1.5 inches or 4 centimeters. So these allow complete chest recall. So the complete chest recall is essential because it allows the chest to fully expand, which creates negative pressure that pulls blood back into the chest and cardiac tissues. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So then give 2 breaths with pocket mask in less than 10 seconds. So assuming that the second rescuer have arrived, so during the 5th set of compression, the second rescuer arrives with bag mask device. Then we have to switch roles and continue doing the high quality CPR. So in this cycle, the role of the second rescuer is to give 15 compressions in 9 seconds or less by using 2 thumbs encircling hands technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So after giving the compressions, the first rescuer will have to deliver 2 breaths with bag mask for 2 cycles. So after 2 cycles, the 2 rescuers will then again switch roles to prevent fatigue. So after we switch roles, we will resume during doing the high quality CPR. So this time, the first rescuer will be the one giving the 15 compressions in 9 seconds by using 2 thumbs encircling hands technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So then after the compressions, the second rescuer will have to deliver 2 breaths with bag mask. 1, 2. So I am now going to proceed to the newborn cardiopulmonary resuscitation. So since this is a newborn, we have to determine the baby's Apgar score. So in this case, the Apgar score of the baby is 3. So the baby needs immediate medical care. So now for the, I have to check the responsiveness by tapping the baby's shoulder and rubbing the soles and calling out her name. Kyle, are you okay? Kyle. So if there is still no response, call for help like code blue or call 911. So after that, we're going to open the airway and suction using the suction valve to remove if there are any obstacles in the airway. So if still there are no response, we have to do the positive pressure ventilation or the PPV using the pediatric bag valve mask. So first is to attach the bag valve mask to the oxygen cylinder. So let's say I have the oxygen cylinder already attached to it. Now I have to cover the mouth and the nose in it. So now allow 30 seconds of ventilation. So this way, we are supplying oxygen to the baby. So also we need to look for the chest rise with each bagging. So after that, allow someone to attach the cardiac monitor and pulse oximeter. So that is to keep track of the baby's heart rhythm. So if the heart rate of the baby is still less than 60 after 30 seconds of PPV, we're going to do the chest compression. So I have to use 2 to 3 fingers when doing it. So I have to place my finger at the center of the chest, just below the nipple. So then press for about 1.5 inches depth of the chest because the baby's bone is not strong enough to handle immense pressure. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So after that, evaluate the heart rate after 4 cycles. So if the heart rate is still less than 60, then continue doing the chest compression and assist in intubation and giving meds. However, if the heart rate is more than 100, we can now proceed to the post-resuscitative care. So we're going to monitor for the vital signs, oxygen stat, and administer oxygen. So also monitor and maintain the patient's airway. So then I have to document the time, the procedures, assessment, and response to the treatment and the medications given.